This was a question which one of the students messaged on Telegram and asked me regarding. So answer for this question I will tell you straight away. So it is comedones which are present. The diagnosis is acne and answer is dietary modifications. Hello dear students, myself Dr. Maddineni. Welcome to Crack Derma DrMSD. So in the acne, we all know topical retinoids are good treatment modality. Trimethoprim is also good treatment modality, and the question was asking least likely to result in any noticeable improvement. So even the face wash with soap and water is also going to help in the improvement in the acne, whereas dietary modifications are not going to help much. So you can see here the washing of the face is going to prevent the pore clogging and potential inflammation. So that is better when compared to the dietary modification. Precisely if in the diet it was mentioned specifically high glycemic foods and dairy, if they are avoided, then it will be a good improvement. Maybe that would have been a tough fight, but here the answer is going to be option C. Dietary modifications, overall healthy eating habits might be of some good, but current scientific evidence suggests that dietary modifications are least likely intervention to significantly improve acne. So I hope this helps. Thank you so much. Happy learning. Bye bye.